Okay, so yeah, thanks very much for that introduction. I was absolutely delighted and a bit surprised, I have to say, to get an NIHR Application Development Award. It was my first time going for an NIHR award, so I'm really pleased to get it. And today I thought I'd just do a fairly informal sharing of my personal experience in the hope that it helps someone else, because I received some really good advice that helped me get this. It's quite difficult to know what would be most helpful to a broad audience, but so what I've done is I've put together 10 slides of things that I think are helpful and sort of offer practical tips, but there will be lots of time for questions. Please do remember, though, that I'm not presenting this on behalf of NIHR. These are my personal views and experiences. What I would say is if you're hoping to apply for one of these awards, really do attend the NIHR sessions and reach out to them with specific questions, because I found them incredibly helpful. Okay, so maybe an obvious place to start is, let's start with what my team was given the award to do. So we're going to spend a year undertaking foundational work that we think is vital to develop an interprofessional research programme, and that research programme is to improve heart failure services and outcomes in Wales. So we really want to do an all Wales programme of research, and the focus is on service interventions. So we started in July, just gone 2025, and obviously it runs for 12 months. Now, I'm the senior investigator on the grant. But the award is designed such that you have two lead investigators, the one that I've got. And my joint lead investigator, Amy Drain, is slightly earlier in her research career. And I'm going to come back to that in a sec, because that's a really important part of what these awards can offer. This grant also allows us to have a project manager, some research assistant, and external clinical collaborator. So it's quite a good chunk of money, and it really helps us. Hopefully it helps us to do some good development work. The nature and the scale of the work that's needed for our research area is such that I could not design the research programme without funding to do the development work. And I think that's quite an important concept, you know. If you can get some of the information around gaps without the money, then you don't need the money. So it's worth really having to think about what you need. But obviously the goal is that at the end of this year, I'll have done with the team all of the foundational elements that we need to make a really strong application to a programme grant for applied research with NIHR or something similar. You know, it could be that we flip to health technology, or that we go for research for public benefit, for patient benefit, but it's that level of grant, a large grant. That's what we're after, is a strong application for that. You'll have probably heard people a lot talk about the importance of person, place, project, whatever words you use in what order in grant applications. So a good place to start, I think, might be to talk about what brought me to this point. So a little bit about me and the context, but only so that you can think of whether it's the right time to apply for something like this. You know, how would you make the funder feel like you were the best person to lead this research is what I want to get across really with this slide. So I've worked in cardiology for around 30 years, and initially that was only in NHS Wales as a clinical scientist. But for the last 20 of those years, I've been a clinical academic. So I've got a contract with a uni and a contract with a health board. And my work is split across clinical work, research, and academic leadership. And because I came from a clinical background, I did my PhD much later in life, completing in 2016. So probably now I would consider myself just about a mid-career researcher. So after getting a few small equipment and project grants, I was really lucky to secure a Health and Care Research Wales Health Research Fellowship. And I've got to say that this has been an incredible experience. It's been transformative. You know, it's really allowed me to lead research, to develop new knowledge and skills. I've learned about implementation science and complex interventions. And I've got a year left on that. So I'm starting to now think about, well, what comes next once my fellowship ends? How do I build on the work that I've already started? And the work that I've started is about, it's with older people who are breathless, often who are receiving care in their homes or in care homes. And it's about trying to improve the speed of diagnosing heart failure in order that we can treat it better. So that's what my fellowship project's been about. And so I've started doing this work about early diagnosis of heart failure and how we could change services to improve patient care. So that's been a really good basis for what I'm building to. Through this process, I've really started to understand the value of holistic interprofessional research. So drawing on the perspectives of, different healthcare professionals in community, primary and acute hospital care. I've started to support my own PhD students, and I've become a lot more interested in building research capacity and capability, both in my profession, but also in some other professions who are sometimes underrepresented in research, so pharmacists, for example. And I think one of the things that's been really good about this journey, as the research has started to develop, is that it's really increased my visibility as a researcher. It's contributed to my reputation as a research leader, and it's given me new opportunities to expand into other areas of heart failure research that I hadn't imagined, 3 or 4 years ago. So things like large data science projects, for example, mapping heart failure pathways for Wales is one of the things that I've been doing more recently. And I mention that because I really think being able to articulate some of that in an application has relevance to showing that I'm a bit of a safe pair of hands, and it relates to my perhaps ability to attract funding and to get on with the project. So that's a bit of the journey so far. And the research that I've been doing has really highlighted significant inequalities of care in areas of service provision that are normally provided by nurses, pharmacists, and healthcare scientists. So I've been working with these groups, and we started to develop an idea for this All Wales programme of research. And the idea is to think about whether we could design some novel service-based interventions that might improve heart failure outcomes across the country. So we're focusing on areas where these professions have expertise and where their strengths are. So things like prevention, diagnosis, monitoring, and that's including patient self-monitoring, and optimization of drug therapy. The thing is, there's quite a big difference between me running a local or regional programme of research in Swansea and then developing a national programme of research that can attract large-scale funding. And I've really felt like this was an enormous chasm to cross. How do I get from this one small project to this something much bigger? And have I got the confidence to do that, really? So we started as a team, an interprofessional team, trying to identify what we didn't know currently that would inform this national programme of research. We didn't have a strong understanding of the current landscape across the whole of Wales. There were gaps, and we didn't really know the challenges that patients and clinicians were facing on a daily basis. We didn't really know what service interventions had been considered or tried in Wales and what outcome measures were being used, what had been published. We know that there are healthcare professions underrepresented in research, but we didn't have any data on research capacity and capability in heart failure teams, specifically across Wales. So, in short, it wasn't really clear whether any proposed programme of research was needed or would be feasible. And that's obviously quite high risk. So to jump straight to an application for a large programme of research, it was too big a gap. We needed to do some foundational work first. Now, we didn't just pluck some of these ideas of gaps out of thin air. We turned to evidence-based theory and frameworks to ensure that we weren't missing anything. And for our work, because we intend to develop complex service-based interventions to test, we used this MRC framework. And this was invaluable, really, because not only has it helped us focus on key areas of work and thinking about, where are the gaps and what do we need to fill, but it's helped us frame those gaps in the application using the right language. So if you haven't seen this before, you start with a red box in the center, and there are core elements that need to be addressed anytime we're thinking about designing or testing complex interventions. So things like considering the context, engaging stakeholders, identifying the uncertainties. Have you got an intervention already? Does it need refining, or do you need to develop something new? And then there are across the outside of that, there are some purple boxes that highlight the potential phases of work. And note that these could be undertaken more than once, some of them, and they could happen concurrently or sequentially. But I think this gives a really good insight into the sort of steps you might want to take in the development phase, and then in thinking forward to the programme of work. So this really informed what perhaps we needed to put into our development award plan. And it helped us to understand, I guess, or to be more confident about what clinicians were likely to accept as feasible, to engage with them better, and it would reduce the risk of failure, perhaps, of any future research programme. But also we want to make sure that when we eventually do this research programme, it has impact. And I'm a big fan of trying to take baby steps on that pathway to impact from a very early stage. So I think bringing people in from across Wales in a development phase is a great way to start that pathway to impact. So I think some tips already that I would like to share, because I certainly found them beneficial, were to try and draw on theory or frameworks that might be relevant to your area of study. Use that language to express what is known and where are the gaps. And then think about whether with funding you could address some of those issues, and are you the right person to lead that work? Who else do you need in the team, or which other teams might you need to connect with? So there are a few different NIHR grants that help you develop a programme of research, and I just wanted to highlight the one that I have, just because there may be differences between this and some of the other development grants that are available. So the one that I have with my team is for health and care professionals, and it's particularly for people who are HCPC registered who are not medics or dentists. So these are professions who are often underrepresented in research, and NIHR has a strategic goal to build research capacity and capability among these professions. One of the criteria is that a lead investigator must not previously have secured a grant for over £100,000. But what's not clear here is that this grant is for, you can have joint lead investigators, and it is the more junior of the two who is being supported to develop leadership skills through this grant that can't have held an award of more than 100,000. So for example, on this award, I am a more senior investigator. I have a grant of more than that, but I'm working with my colleague Amy Drain, who has a PhD, is an ECR, and has yet to hold that. But we're leading this together, so I'm supporting her in that. And it works really well for us, this grant, because through my fellowship, I've started to build a small team of other healthcare scientists who specialise in ultrasound heart scans, and they span people who are pre-doctoral award, immediately post-PhD, and then a few years post-PhD. So within this award, I've been able to cost in different roles, as for example, research assistants, as well as the joint lead investigator with me. It's also meant that I can cost in the input or the time from external collaborators in the NHS. So, for example, we can pay Swansea Bay Health Board for some nurses and pharmacists and cardiologists and GPs to come and collaborate with us on this development work. So it's been really helpful, and a lot of those people are new to research. They haven't been involved in research before. So in picking this grant, what we decided to do, following advice from others, is read, reread, reread, reread the guidance notes, and really be certain that what we were proposing was within scope, that we knew we met the eligibility, and that it was the sort of thing the funder would find attractive, that they would really want to put in. And we used the language that was in the guidance report back in the application. So we made sure of saying, NIHR said they wanted this. Well, this is what we're giving you. You know, we're doing exactly what you've said you'd like to fund. So I think just some top tips from this, you know, why we picked this one is just, you know, you maximize your chance of success if you pick the right award to go for. We really felt like we had a very good chance at getting this. We were fairly confident, and we made sure we reflected the language back from the application form, from the guidance notes in the application form. We also talked to people who'd previously been successful in getting an application development award, and we looked at the published awards on the NIHR website, and we thought about whether the components we were proposing were kind of aligned or similar in depth and breadth as to others that had been successful before. One of the other things that was really important in this particular grant is you had to specify what your end goal was. So at the end of your year of developing your research program idea, which grant are you then going to apply for? So we didn't just read the guidance notes for this award. We had to go forward and think, right, where are we heading? Is it a program grant for applied research? Is it health technology assessment, or is it something else? And we had to align our proposal with where we were heading. So hopefully that makes sense. So I want to move on now to the kind of where should the research be done. And I think it's very easy to fall into the trap of, I'm in Swansea, so I'll recruit patients and do the research there. But that does not make a compelling argument for funding, particularly with NIHR. So NIHR will absolutely expect you to have done some work around where is the greatest unmet need for your research. So if the greatest unmet need, the greatest burden of disease or most underserved population are in Pembroke or Birmingham or Glasgow, then why is your research based in Swansea? You know, have you thought about collaborating with other sites in other areas? So I've said a little bit earlier, my research is in heart failure. Now, luckily for us, there is a published cardiovascular atlas of variation, and this gives us heart failure statistics for Wales. And it shows here, these are rates of emergency admission for heart failure in Wales. A darker colour is higher rates of emergency admission. But what it shows is there's considerable geographic variation across Wales. There's a lot of geographic variation in how well we're doing at preventing people coming into hospital with heart failure. And you can see there are a lot of clusters in South Wales, particularly where there are high rates of admission. So places like Powys, for example, are different from places like Pembroke and Newport. And that's really important for our proposed work, because the challenges in those different regions are affected by things like rurality, specialist service provision, socioeconomic deprivation. And so if we're thinking about interventions that might work in those areas, it's not necessarily going to be one size fits all. And what that tells us is we need to draw in stakeholders from across Wales into our development programme. And that's what we've done, really. NIHR will also expect you to think beyond Wales. And so while we were able to articulate in our application form, there was a need to focus in Wales because our heart failure outcomes here are worse than they are in England. we did have to show that we are connecting and collaborating with sites in NHS Scotland and NHS England to share our ideas, to learn from things they've tried and in developing interventions. The other thing I think is important is to think about how you can align what you're doing with larger research organisations or groups. You know, trying to show there are eminent researchers who can support your work or offer an informal mentorship, help with visibility of your project, and they're also going to be helpful in thinking about or realising future impact. So I'm part of the National Cardiovascular Research Network in Wales. This is a network that's funded by Healthcare Research Wales and British Heart Foundation. And in my application, I could articulate how our proposal aligned with their strategic priorities and how they would support us. So top tips here then from me. Use the stats to identify where is the area of greatest need and the population of greatest need, and make sure you show that you're including those people in your research. Do expand your horizons. Do think beyond your immediate team and your locality. Try and link with others elsewhere. And I think it is important, if you're fairly early in your career, to collaborate up, to try and find maybe people who are more experienced in the research journey, who are very, very visible, who can help you on your journey. So kind of already started to touch on, you know, who you need to include in your research in terms of participants and where they need to be. But I just want to highlight how important inclusivity is and how you address that in the NIHR application. You know, there is a new drive now, there's new guidance on inclusivity in research with clear documents around how this is best achieved. So please do go and read that guidance and understand that it relates to all elements of work, not just your participants. So it has a bearing on your research team. It certainly has a bearing on the participants, but also your study design. So if, for example, the area of greatest need, as it is for me in heart failure, is a very elderly population, often very rural, and who they might be receiving care in virtual wards, if I can't include them in my research, then I'm not including the right people. Inclusivity obviously also extends to your public contributor. So do have a read of the NIHR guidance. In terms of the public contributors, or PPI as we used to call it, NIHR give very, very specific guidance about how to do this well, how to train and support public contributors, and how you should cost them in. It's an easy thing to get right if you follow their guidance. They're very alert to tokenism, and you want to avoid that at all costs. So, you know, public contributors might need training and support. You need to help them feel as important and confident in contributing as anyone else in the research team. And I would also say that Health and Care Research Wales has a very helpful team in terms of public contributors who can help with recruiting and preparing people. So there's a lot of information available online. I've put some of the web page addresses here. They're quite easy to find, and I'm happy for Health and Care Research Wales to share these slides after the event. One of the things that I found is that I undercosted the caring costs of the public contributors, and I would caution against that because it's causing me some difficulty. I had caring costs in my award, but I hadn't envisaged, because we hadn't recruited the public contributors before I put this grant in. I needed new public contributors. I didn't realise how many of them would need caring costs. So, you know, a little bit of a plug, if you like, for definitely not undercosting public contributor involvement. It gives the impression that you think it's less valuable, even if you don't, and it does risk their involvement being sporadic or ineffective. So be inclusive across all aspects of your work. Use the NIHR guidance and costs. Definitely don't undercost, and think about things like home office costs and carer costs, not just attending meetings and reviewing documents. So this is my penultimate slide. but it's probably the one that a lot of people will be most interested in, and I might spend a bit more time on this one really. I want to show you how we structured the work in our development project, because before going for this, I had very little awareness of kind of where the bar was, if you like. What are the typical or expected components of a development board? And I was really lucky that Monica Busa from Health and Care Research Wales put on a webinar and gave a few of us some advice on what she had done in the past, and that was really, really helpful. So I'm going to pass that forward and share mine with you. Now, it goes without saying that there are many other possibilities besides what I'm going to share with you, but hopefully this gives you a little bit of insight. So where we started was we wrote some objectives for the whole year and just started by organising those into linked work packages spread across the 12 months. So it looks a bit like this. So in work package 1, right at the start, we wanted to find a way of summarising the existing heart failure services in Wales, identifying future potential trial sites, and hearing people's ideas about what interventions we could use, what they heard of, what did they think might work. Having established that, or kind of mapping the landscape, we then, in work package 2, we wanted to move on to thinking about, okay, well, what's the evidence base for what we do now, how effective it is, and what's the evidence base for the interventions we're starting to think about. We want, at the end of this work package, we want to be able to propose some service interventions and outcome measures that might be suitable to trial. So we're trying to whittle down some suitable interventions here. Now, this isn't a mistake. I am jumping across to work package 4. You'll see why in a second. And in work package 4, what we wanted to do is to develop a cross-Wales consensus on exactly which of those proposed service interventions we were going to include in an application for a programme of heart failure research, and also what outcome measures we were going to use. We didn't just want it to be the view of our core research team, we wanted to say there's a consensus in Wales, and therefore to be confident we'd have buy-in from lots of trial sites across Wales. We've also got, so those are sequential, those work packages. One is dependent on the other having been done, but we've also got a concurrent work package. And this really is testing the feasibility of bringing heart scan data from routine practice. So standard, in a standard healthcare system, heart scan data is recorded, and we want to test the feasibility of linking that with primary and secondary care outcome data in SAIL. And the reason we're doing that is because we think our future programme grant will use data science and echo measurements to understand the impact of the interventions that we're proposing. So we have these objectives and we've spread them across these work packages. What I'll share now is how that translated into the methods. So in work package 1, we started with developing a steering group that meets monthly. We recruited 8 public contributors, or that's the plan. We're up to 6 at the moment, and they're drawn from across Wales, and they're a diverse group. We wanted to establish a network, an online electronic network of anyone who was interested in heart failure research across multiple professions. And we've sent out a survey to establish research capacity and capability, and we've delivered a sandpit event to brainstorm what are the current services, what are the challenges, and what are the potential innovations. In work package 2, now this is a systematic review and meta-analysis of the evidence base for these interventions, but we built in to our costs of the grant Cochrane training for systematic reviews and analysis for 4 people in the research team. We built in costs for support from trials unit. We'll obviously publish our systematic review protocol before we do it, and then we'll have the paper of the meta-analysis. In work package 4, We know that we need to use a Delphi method to get consensus across multiple professions across the whole of the country, and I had never done this before. So we costed in an external consultant who's got an international reputation of doing this, and she's going to help us with that. And as part of that 2-round Delphi process, we're going to have an expert panel and a survey that's going to be disseminated. And then in work package 3, we've had to get information governance approval and a data sharing agreement with the local health board, develop a protocol, extract the data, link it via SAIL, and then do a feasibility study. So hopefully you can see how the objectives have tracked into methods. And I just want to highlight that in each of those work packages, there are potential outcomes that we could publish. Not all of them would be published in an academic journal, but certainly there could be briefing papers to stakeholders or to policymakers. There could be dissemination to the public. And I think this is quite an important point, that we're not waiting until the end to have an output, if you like. And I think one of the things that was really important in us getting the award was the fact that we'd used quite a robust methodology in our design. So, understanding what the guidance is for doing and reporting a systematic review and meta-analysis, and the same for a Delphi consensus, and the same for a data science feasibility study, and being able to feed that into the application form. I think that was really important, but also showing that we were happy to cost in experts where we didn't have that expertise, and I think that's probably very I'm sure it helped us with our success. So some final reflections before we come to questions. Definitely go to any webinars that are put on for any of these development awards. People will often give extra detail in what they say that goes beyond what's in the guidance notes. So I think that's really helpful. I have found it super helpful to work with an established trials unit. So I worked with people in Swansea Trials Unit to talk to them about both support services, but also shaping it. How does this look? How does it come across? What are the costings like? Do you think this is reasonable? And NIHR do expect you to have worked with some sort of research support service. So linking with Health and Care Research Wales and in any trials unit that you can link with are important, and you need to put that into your application form. I found the NIHR application process very straightforward. I didn't find it as onerous as I thought it was going to be. What I would say is to be prepared to adapt to changes in circumstances. So, for example, one of my team was lucky enough to become pregnant in the period between us putting it together and the award being offered. So we had to have a backup plan of how we were going to change. So be prepared to adapt, otherwise you lose the opportunity to conduct your award. NIHR have been very, very helpful pre and post award. They're really approachable. So don't feel like you can't go to them. You definitely can. The funding gives really good visibility, esteem, and it certainly supports you to do more robust work. Getting this award has enabled me to reach further than I had imagined. And now people are contacting me from outside of Wales saying, I'm interested in collaborating with you on this, can we get together? And I don't think that would have happened if I didn't have this badge of an NIHR award. So I would encourage you to go for it, but to think carefully in the preparation to maximise your chances of success. I've got no doubt that the work we're doing in this programme will strengthen a programme grant application. We've already finished work package 1, we're nearly finished with work package 3, and it's clear to us that we needed to challenge some of our assumptions, and things have come out of the work already which we weren't expecting, which are really impactful. So I'm hopeful for our chances of getting a programme grant in future. Okay, so that's all the slides done. I really hope there was something in there for everyone, but really happy to take questions if I've not covered things that you needed to hear.